All right. Good afternoon, everyone. Can you hear me? Hi. Good afternoon. It's so nice to see you all. Welcome to our Field Michigan Medicine Placement Information session. My name is Erin Kong. Some of you may have seen me during orientation, but I'm the field director here. Just really excited to welcome you to the session. My only job is to introduce our colleagues here. So I do want to say a huge thanks to our Michigan Medicine field faculty. So there's actually two field faculty who represent all of Michigan Medicine. Amy Brandt is there representing the geriatric-esque, most of the geriatric placements at Michigan Medicine. And Amy Vantin, I'd like to introduce and welcome up. She'll be your next speaker. So welcome, everybody.
Thank you, Erin. And yes, thank you so much. We're really excited to have you all here to be able to talk about Michigan Medicine field placement opportunities. And really want to thank all of you from Michigan Medicine to be here, to join us here in person. We likely have some who are joining us here online as well. So thank you all for being here. It is not a requirement to be named Amy to be a field faculty working with Michigan Medicine, but we are, Amy and I are both really excited to be able to work with Michigan Medicine. They do provide really wonderful, amazing opportunities for students to do some incredible learning. And while we can never guarantee placements for students at Michigan Medicine, we really want to be able to have this opportunity to talk with you about learning opportunities there. We will talk with you about what the placement application process is and to give you a little bit more information about that. So we really want to be able to take some time to do that briefly and then really give you an opportunity to hear directly from our colleagues from Michigan Medicine to hear more specifically about some information there. So welcome. There are beverages in the back. It looks like some people have found those, so please help yourself to that. And we will go ahead and get started. So hopefully these slides will work. They were working before. There we go. Okay, so here's how we'll spend our time. Again, we did some introductions. I'll show a slide here again just to introduce our Office of Field Education as well. We'll talk through the field application process, our placing timeline, because it's going to be a little bit different than what it is for the general placing process for all of our field placements. Then I want to talk specifically about some considerations for placements at Michigan Medicine and some expectations, because there are some unique things with regards to placements at Michigan Medicine. Then they'll be talking about what Michigan Medicine offers to students. They'll talk a little bit about roles and field placements available for the winter 2025 semester. They'll talk about some keys to success and then some time for questions and answers. So that's how we'll spend this time. And you've probably seen this slide a little bit. Just want to again remind you of our field education team, our leadership team, as well as our administrative team. Some of our members are here today. This is our field faculty group as well. So again, just want to share with you our faces a little bit. We want you to feel really welcome to come to our offices if you have any questions regarding the field placement process at all, not only with regards to Michigan Medicine, but the whole process in general. So wanting to share, these are some important application dates for students starting winter 2025. Now, again, this session is really specific to Michigan Medicine, but this slide here is not only talking about Michigan Medicine. This is really talking about applications in general as well. I just wanted to be able to highlight that there is a difference. If you decide after the session that you want to apply for a Michigan Medicine field placement, there is a different date. So today you are attending this Michigan Medicine information session. This is September 4th. So this is where you are for this information session. If you decide that you are going to want to move forward with a Michigan Medicine placement as a first priority placement of interest, there is an interest form that you're going to need to complete. It's a Google form, and there's some slips of paper that we have on the desks there, on the tables there. There also will be a slide here shortly to be able to have the QR code. You would need to complete that interest form, this Google form, by September 6th, because there's going to be an early application if you want to identify a Michigan Medicine placement as your first priority placement. So it's going to be an early application if you want to apply for a Michigan Medicine placement. Applications are going to open early They will open September 7th, and your application will be due by September 11th. So that is an early application that will only be open to students that have completed this Google form. If you don't complete that Google form, then you're not going to have access to that early application. So you see the dates, the applications are opening in general for all students that are going to be planning to start field for winter 2025. They will open later in September. So again, if you decide that you want to move forward with the Michigan Medicine placement as your first choice, you definitely want to complete that Google form by that date. So this is the timeline, the placing timeline, again, specifically for Michigan Medicine. We're here on this timeline. Today is this information session. That interest form, again, due September 6th. The application deadline, that September 11th date. Late applications are not going to be accepted. And we say not accepted. People can still prioritize a Michigan Medicine placement, but when we say not accepted, it means more so that you won't be prioritized for those placements. So placing is a very dynamic process, and sometimes even though Michigan Medicine tends to be a high priority placement, lots of students tend to prioritize Michigan Medicine for top choices. Sometimes there are still placements at Michigan Medicine that don't have a fit with students. And so sometimes there could still be placements that are available. So it doesn't mean that that there could still be a placement available later on in the placing cycle. There is still a potential that could be. So it doesn't mean that there could never be a potential possibility that a student couldn't be placed at some point later down the line. There is a potential for that. But again, we're talking about priority. So it is really important to be able to get that date in. As you can see then, starting September 12th is when Amy, my colleague, and I will be reviewing those early applications. We as field faculty always review your applications first, make sure that what you've completed seems to be in line with what the placements are. And we'll be reviewing those materials. And then we will be sending them off to Michigan Medicine for those field instructors to be reviewing those and making some decisions on if they would like to be offering interviews to students. We are asking for Michigan Medicine to make those decisions and to be reaching out to students around scheduling for interviews or declining those decisions by September 27th. For the most part, there is a team that might not be able to make those decisions until early October. So we will communicate that with students who are prioritizing with that particular team. But in large part, students will know that they will either have an interview or they will know that they've been declined for an interview by that September 27th date. That does not mean that you will have had an interview by that date. I just want to clarify that. It's that you will know whether or not you will have an interview. Those that would not be offered an interview will then move into the next prioritized placement that you've selected is kind of a secondary, the second choice that you have. So again, this is the similar information that you have on your tables there with the QR code for completing that Google Doc to be able to have access to that early application for Michigan Medicine. Okay. So have your goal statement and resume ready so that when the application opens that you will have that available. This is information that has been shared with you regarding the field application process. You do provide a goal statement, 1 to 2 page written statement that this will be shared with the potential field placement, the potential field instructor for that placement. And so please do follow the goal statement guidelines that are laid out on our website. There are some helpful resources on the website and also include that resume as well. Those are the 2 pieces of information that are shared with the potential field instructors. So please make sure that you are checking your UMich email regularly to make sure that you are able to respond if you are getting any email communication regarding potential interviews. Sometimes we've heard from students that say, oh, I don't really check my email that often. And that's really, really important for you to do in terms of communication. So Again, this process here. Application is going to be reviewed by the field faculty, and you will get either the interview offer or a decline. And if you are then offered a placement, then congratulations, and that will be completed. If at the end you are not offered a placement, we will then be working with you on whatever that next step is going to be, on whatever that next step placement is going to be. So we work through these cycles all of the time, and we always are able to place students. So we will be delighted with you if the placement that you want is what the end outcome is going to be, and we will celebrate that with you. And if that is not what the end outcome is, then we will work with you on whatever that next step is going to be, whether that will be directly with us as the field faculty for that next organization or with one of our colleagues. But we will get you to through the next process with whatever that next field placement will be too. And we will celebrate with you a success at some point because we are able to place every student. Couple considerations we want you to think about for sure too that are unique for Michigan Medicine. So again, Michigan Medicine placements are not guaranteed. So we always want to be really clear about that. Michigan Medicine placements are all being filled at the same time. So it is not uncommon for students to be interested in multiple placements at Michigan Medicine. You are going to be selecting 3 choices on your field application. What's your first priority, second priority, and third priority in terms of field placements? It is not usually in your best interest to say, I'm most interested in adult inpatient psychiatry. Second is adult outpatient psychiatry. And third is child inpatient psychiatry. Because all of those placements are being interviewed, all of those placements are interviewing students all at the same time and are filling their placements all at the same time. So if you're interviewing all 3 placements, if you're prioritizing all 3 placements at Michigan Medicine at the same time, by the time you get through your first choice placement, all of your second and third choices are probably going to be filled also. So it's really important to diversify your application selections. Look at what the other potential opportunities might be outside of Michigan Medicine that could be of interest to you for your second and third choices. If you are very interested specifically in a placement at Michigan Medicine, maybe consider something that might be different. There are sometimes mixes of interpersonal practice and macro placements that you'll hear a little bit about that sometimes don't always rise to kind of the first choice interests of students. They don't stand out as things that students immediately think about, but there can be some absolutely excellent opportunities for students to have great learning experiences with. And actually, students that I've had in some of those placements say, I never would have thought that this would be a placement that I would have picked, but I am so glad that I had this placement because I've had the most excellent opportunities here. So sometimes they've been so glad they didn't get their first choice because they've had the most fantastic experience having this really great mix of interpersonal practice and macro experience. Michigan Medicine does require students to be in placement 24 hours a week. So it is really important for students to understand that you would need to use some of your elective credits for additional field time. That's a really important thing for students to understand. So you would also need to complete an out-of-sequence petition to account for a unique schedule that students need to do for Michigan Medicine placements. And students need to be in field for 3 consecutive semesters. So the 16-month schedule is required. So for students that are 20-month schedule, you would need to switch to a 16-month schedule. So we have students that make those choices and change their schedule. Students do participate in a student program, which you'll be hearing a little bit about, which meets on a specific schedule, either a Thursday morning or a Tuesday morning. So you would need to make sure that you are able to meet that schedule requirement as a student with Michigan Medicine. And there's also a class that is required for students. This is required from Office of Field Education. This is not a Michigan Medicine requirement. This is Office of Field Education requirement. It's a Social Work 714 class, which is an interprofessional experience class around team-based decision-making, and that happens in the winter semester. So that is a requirement as well. Really for any healthcare-based placement, that is a requirement. So those are some expectations that are also important to be considering for these placements. So those are some things we want to make sure to mention to you. And again, just want to thank all of my colleagues here from Michigan Medicine. And I want to be able to introduce David Fulkerson, who's one of the managers at Michigan Medicine and has been in charge of the student program here now So David, thank you.
Thank you, Amy. Good afternoon, everybody. How do I advance the slides? Sorry. Click. Yep, I think I figured it out. Okay. So I've been trying to figure out, I want to apologize for how complicated this is, but it's not my fault. So I just want to say I empathize. I empathize with you. I empathize with all of you. Because 10 years ago, I was in your position, although I was downstairs because the meeting was down there at that time. And I went through this process. And here I am now on this side of the table. And we were all just talking about how interesting and odd it feels to be on this side of the table doing this now. So it is a great pleasure to be talking with all of you today about the placement opportunities that we offer at Michigan Medicine. So what do we offer? Our placements at Michigan Medicine offer an array of didactic and hands-on experiential learning opportunities. Most importantly, our field instructors, both past and present, are the best and top-of-the-line instructors. Collectively, we have several decades of experience spanning psychotherapy, case management, private, medical, mental health, public health, research, management, and leadership. We offer weekly mentorship courses. So each semester you will be given the opportunity. The first semester is kind of not really your choice. Your field instructor will work with me as the acting program manager for social work education to decide that for you. But the second and third semesters, you will be given an opportunity to choose from those mentorships. The mentorships include various modalities in psychotherapy, like cognitive behavioral therapy, dialectical behavioral therapy, child-parent psychotherapy, but also broader subjects like social work ethics, in working in crises, psychiatric crises, palliative care, things like that. We also offer weekly workshops and seminars, and those are set. So each week you will have half of 1 day of your field hours will be that mentorship in the morning for half of that morning. And then the second half of your morning will be a seminar. And that seminar will have various topics throughout the 12 months of your field. Kind of weighted more skills-based at the beginning. So a psychosocial assessment, things like that, and then weighted more towards professional skills, preparing you for applying for your job, post-graduation, things like that. We also offer a clinical skills training series, which is where I think a 10-week hands-on experience where you will be working in a small team with a clinical social worker in a hospital inpatient setting, where you will rotate with a small team of your colleagues, of your fellow interns, doing psychosocial assessments with a live actual patient in a inpatient room. And then you will learn firsthand how to do a psychosocial assessment and then present that assessment to your clinical instructor and the rest of your team, and then rotate through various parts of that assessment through that series. We also offer a series of interprofessional educational experiences. Those we partner with various other interprofessional, other professions in the health system, like the Department of Pharmacy. And this includes Grand Rounds series. So Grand Rounds, you're aware, Grand Rounds are educational experiences where we invite social work interns who have worked an interesting case, and they can apply to present that case as an educational experience to the entire social work department. And each semester, one of those Grand Round series is done interprofessionally. I'm sorry, a couple of those are done interprofessionally with the School of Pharmacy on various topics, one of which is with working with gender diverse individuals. But we also have social justice Grand Rounds each semester that can be on any topic. And then the IPE Social Justice Grand Rounds is the one I just mentioned ahead of myself there. Sorry about that. And then each semester we offer All Women Are Leaders, which is a lunch and learn. So during lunch hour, another seminar where we have students apply to present a learning opportunity to the Department of Social Work. Inpatient care management social work. One of my colleagues will now talk about that area.
Hey there, my name is Sophia. I'm one of the inpatient care management social workers at U of M.
Hi, my name's Heather Reed. I'm also one of the inpatient care management social workers.
So the thing to know is when we say inpatient, we're specifically talking about inpatient care management. And that's actually a dual role. So in this position, you're part clinical social worker and you're part discharge planner. And that's really the most important piece, is to know that we wear both hats throughout the entire time that you're with us. So every unit operates a little bit differently, but you're one piece of a really big interdisciplinary team.
So this slide's a little bit packed, but this is kind of some of the highlights of things that you would expect to see within our role. So I'll just kind of touch on them briefly. So substance use assessment and interventions, code response. Some of us in the hospital carry the code pager. So if there's a cardiac arrest or respiratory arrest in the hospital, social work is part of the team that responds to that. So we do see some crisis intervention work. Home safety assessments, suicide risk assessments, and partnering with psychiatry. End of life work and hospice placement, working with folks through grief and loss support. Intimate partner violence, domestic violence concerns, mental health concerns, and connecting folks to resources. Addressing homelessness and housing concerns with patients, kind of navigating various community resources. We're kind of professional problem solvers in a lot of ways. Navigating legal custody concerns, so potentially navigating like legal guardianship, or if patients come into the hospital with some kind of legal concern, navigating with them through that process. In Mott Children's Hospital, it's often to partner with organizations like Make-A-Wish or Rainbow Connections. Facility placement, so that kind of ties into some of the discharge planning role. We do partner with other disciplines in the hospital on discharge planning, but some placements do fall within the scope of social work. Working through abuse and neglect concerns, so partnering with CPS and APS, navigating financial concerns with patients and families, complex adjustment and family adjustment work, often working with folks through a new diagnosis. Prescription assistance and insurance concerns, power of attorney, and transportation needs for patients. So kind of a whole lot of things that you'll have an opportunity to see with us.
So within care management, the last slide shows a slew of the things that we're responsible for, but some of the units do more of these things than others. So when we talk about placement options, there's so many units within the hospital that we're going to talk about general medicine, ICU, specialty, and like give you information from there. So when we say general medicine, these are patients with a variety of illnesses and reasons for coming into the hospital. Folks on gen med units are typically turning over much faster. So an average length of stay is like 1 to 3 days, unless you have a patient who needs something like a guardianship or a placement that's a really challenging issue. And those are like your 30-day or longer folks. But primarily in general medicine, you do a lot of crisis work, a lot of discharge planning work, a lot of substance use assessments and those kinds of things in that area. And you're doing them quickly to turn them around. Surgical and specialty, we kind of smudge these together. So there are some units that primarily deal with neurology patients, right? So in that service, you're working with a lot of seizure disorders, a lot of brain tumors, a lot of behavioral issues, right? So in those situations, you're doing a lot of problem solving and supporting with your staff and patients and their family members through some of those things. You have certain surgical areas or folks that deal more with transplant related issues. I'm on the hematology oncology service, so I do a lot of goals of care discussion, a lot of insurance issues because medications are ridiculously expensive. So like those things come up for folks. Or the Odo service, you do a lot with head and neck cancer patients. You're doing a lot with tube feeds and community resources for how you get those supplies, right? So you're still responsible for all of the other things, but you're doing a little bit more of these specialized things for those particular people.
And then intensive care units. So the hospital has multiple intensive care units. I work on the progressive critical care unit, which is 8D at Michigan Medicine, which is a joint ICU and step-down unit for pulmonary patients. But there's also neurosurgical, critical care, trauma burn, surgical ICU, and cardiac. So really, when folks are in the intensive care unit, they're critically ill. So we're working with patients and families, oftentimes in a crisis, and oftentimes seeing folks who might be approaching end of life. So often partnering with the medical team very closely in terms of facilitating family meetings and goals of care discussions, often working through potentially ethical dilemmas and concerns about decision-making, helping the teams identify who a patient surrogate decision maker is, assessing if this person's acting appropriately as a surrogate. So those kinds of things are pretty common to see. Length of stay can really range. Sometimes a short length of stay, and sometimes we have patients in the intensive care unit for weeks to months periods of time. So you really have an opportunity to build close rapport with those patients and families.
And that basically sums up inpatient care management. I think there'll be questions later.
Thank you.
Yeah, sorry, I should have clarified. We're going to go through the slides and then everyone else here can answer questions about specific sites and placements. Except for this part where Camille and Gloria talk about it.
Well, good afternoon, everyone. I'm Gloria Patterson, and I'm one of the inpatient psychiatric social workers. I've been doing this for quite a long time as a clinical instructor, so I'm going to give Camille the opportunity to tell you what we offer on the inpatient psychiatric unit.
I see what your was. I see. I knew you had a plan. Okay, let me know. Interrupt me. Gloria was my field instructor 9 years ago. We're still going. 9C is a 25-bed psych unit. It's our inpatient psych unit at the main hospital. The length of stay is fairly short. On average, it's 3 to 7 days. So it is a lot of kind of acute stabilization, conversations focused on safety planning, and urgently connecting to whatever the next level of care is in the outpatient setting. We get to, I kind of divided this in half so that each of these areas, each of the placement areas could talk about what is the same and what is different. Because a lot of the things that like they just talked about are things that we'll do on 9C too. So there is certainly a lot of overlap. Social work interns on our unit get a lot of practice with biopsychosocial assessments. We see our patients every day that they're on the unit and that we're there. The days after the biopsychosocial assessments, we're doing various brief therapeutic interventions, mostly CBT, DBT, motivational interviewing based, depends on the situation. We work really closely with an interdisciplinary team. We have a meeting every day with all the disciplines on the team, and then we need to be in contact with them throughout this day to make sure that everything's working together. And a lot of our role is not spent in the patient's room necessarily, but also in our office, making phone calls, updating their families, safety planning with families, coordinating with outpatient therapists, providers to help support their care. I wanted to point out some things that might be unique to 9C that would differ from the other placements. Something that we really get to do a lot is provide psychoeducation to family members about illness. So this might be if a diagnosis that's new is given to the person while they're in the hospital, the doctor is educating the patient, and then we can take that and educate the family so that they can be more supported when they get home from the hospital. We also get to facilitate court hearings when someone is brought to the hospital on an involuntary basis. We follow the mental health code and help them walk through all of the steps of that process, talking to their attorney on the phone, being able to present at the hearing, potentially deferring the hearing and signing some paperwork and not doing that. And I wanted to point out that this is a fully on-site placement. We don't ever work from home. We're always on site, which is good. What did I miss?
You did a good job, Camille.
I think that's a good thing to reiterate, actually. When you look at our field placements, we are very careful to point out some of these are going to be on site, some of these are going to be virtual, some of them are going to be a mix. Okay, so please pay attention to that, because sometimes transportation can be a challenge, and certainly parking can be a challenge. So if you live off-site or off campus, Please keep that in mind, okay? So adult ambulatory psychiatry, I will talk a little bit about both our adult and child psych placements, and then we have representatives here to answer questions at that point later on. So again, areas of overlap, they work on interdisciplinary teams, meaning in their case, psychiatrists, advanced practice practitioners, so nurse practitioners or physician's assistants, and social work, along with psychologists, medical assistants. Adult ambulatory psychiatry operates a lot of group interventions, so CBT, DBT, motivational interviewing, amongst others. The unique areas, you will get the opportunity to perform psychiatric assessments and diagnosis using the DSM-5. Evidence-based, you will be trained in the use of evidence-based psychotherapy with observation. So you'll be observed, fully observed by your supervisor, usually with over a camera, over Zoom. You can expect to have a therapeutic caseload of around 5 patients per week. You will have the opportunities to participate in group therapy, usually observation at first. Case presentations and written formulation. So you'll start to write your own case notes and working with your supervisor alongside of you, and eventually, pretty quickly, honestly, start to write your own notes and begin to do that on your own, and then pretty soon you're writing your notes, sending them to your supervisor. They're really just proofreading them and making sure that they agree with everything and signing those notes off. So you really will get that opportunity to write those notes on your own and formulate that case. Areas of specialization include the treatment of depression, anxiety, perinatal concerns, and the crisis support clinic, which is a short-term clinic, usually post-inpatient treatment. Did I miss anything? Did I miss anything?
And I guess I'll just add to that, that this is really a placement for people who have a well-defined career goal of wanting to train as a psychotherapist, which I know is really the case for a lot of people here at the School of Social Work. Some people think, well, I really have no interest in ever working in a hospital. Well, we still get lots of applicants from people who plan to move on to other types of psychotherapy settings after they do their training with us. We offer really high quality opportunities to learn a range of psychotherapeutic modalities. You get the chance to be observed and work really closely with a field instructor. It's really, I think, a very good opportunity to learn psychotherapy skills.
And the same is true for child and adolescent ambulatory psychiatry. Lauren, next to Martin here, is a former intern in child and adolescent psychiatry and a current fellow. So she will be able to answer any questions that you might have and hopefully fill in any gaps that I might miss here. But again, areas of overlap, working on interdisciplinary teams, and again, working in group interventions, unique areas, psychiatric assessment and diagnosis with DSM-5, but in this case, working with children and adolescents, often working with their parents and families, actually almost always. Evidence-based psychotherapy training, again, with observation. Pretty much the same caseload of around 5 patients per week. Opportunities to learn about child development and family dynamics. So similar set of mentorships and training clinics, but formulated for working with children and adolescents. So inclusion of child development and working with families. Because if you're working with children in psychotherapy, you are working with families. Case presentations and written formulation. And again, areas of specialization, including infant and early childhood clinic, which is working with young children who have experienced trauma or separation, or and then autism spectrum disorders, depression, anxiety, obsessive compulsive disorder, and ADHD and other neurodivergence. Did I miss anything, Lauren? Okay. And then also housed in the Rachel Upjohn building with outpatient psychiatry is the University of Michigan Addiction Treatment Services. You can see that the areas of overlap are pretty similar. Unique areas for UMATS is substance use disorder assessments and diagnosis with ASOM and the DSM-5, evidence-based psychotherapy training, again with observation, therapeutic caseload of around 5 patients per week. Again, this is observed. Opportunities to participate in group therapy. They run group therapy for adults and adolescents. They also run an intensive outpatient group clinic, which is, I think, 3 hours, 3 days a week. And then case presentations and written formulation. So again, very similar in structure, just working with a different set of diagnoses and a different groups of patients, different populations. And area of specializations include adolescent and adult, intensive outpatient programs, and early recovery programs. And then we've got a lot of hybrid and macro placements here, and we have some folks here to answer questions about these. I feel like we gave these a little short shrift just because there's a lot of placements here and they're all shoved together on one slide. And that's because if I put all of the descriptions here, it would be probably 20 more slides because these are really interesting and really diverse placements. And I just want to kind of reflect on what Amy said at the beginning. Try not to focus so much on any one placement. These all have really interesting and amazing opportunities. I personally was in 2015 when I was a student here. I applied for they don't have this track anymore because they probably realized it was a bad idea, but because I was told it was a bad idea. I was interpersonal practice and mental health and public policy, which I was told I would never find a placement that fit that. And I did at Michigan Medicine in comprehensive gender services. And it really wasn't listed that way. They wanted 2 interns. They wanted an interpersonal practice and mental health intern and a public policy intern. But then when they interviewed me, they realized that I had both and they decided to just get 2 of me, which they managed to do. So because there was one other student who had my exact same tracks. So I was able to get a perfect fit and I was able to work with patients and learn psychotherapy. And I was able to do policy work and work with the NASW of Michigan. I was able to work in the hospital and develop a bathroom policy for transgender patients that never went anywhere, but it was a really fun experience to work on. So there are a lot of really cool opportunities in these hybrid and macro placements. So I really encourage you to look at all of the placement opportunities that we offer. I know that there was a lot of stuff at the beginning and a lot of things that kind of sound stressful and a lot of hoops to go through, but it really is worth it. We offer an amazing opportunity with a lot of diverse experiences, and I really don't think you can get an internship experience anywhere else. I know that Amy and Aaron asked us to put a few of our ideas for keys to success. And so we thought this through. We really feel like, I know some of these sound a little bit tropey, but they're really true. We feel like a commitment to learning is really important. We feel like seeking a diverse educational experience. So one thing that I didn't mention, and we probably should have listed on the things that we offer, is preceptorships. And so if you are in a field placement at Michigan Medicine, starting in your 2nd semester, we put out a list of preceptorships, which are basically mini field placements. So it can be an hour where you just go shadow with a social worker for an hour in any place in the health system. It could be completely different from your field placement. You could be an outpatient adult psychiatry, but you're really interested in what a social worker in palliative care does. So you go shadow with them for an afternoon. Or you're really interested in what it might be like to work in PES. So you go shadow with them for 4 weekends. So it's really up to you and that social worker to design how long you want that experience to be and what you want that experience to look like. And as long as you can fit it into your schedule, you can really make that look how you want it to look. So it's really just the vast variety that we offer. I don't know that you could get it anywhere else. So if you're really looking for a lot of opportunities to get kind of a very broad view of what a social worker can be, because I don't know of another profession where there are so many opportunities to use your degree in so many different ways as social work. And I think working in Michigan medicine really gives you that opportunity. Flexibility and ability to adapt to change. Medicine, healthcare is a very fast-moving environment. Yesterday, I had 2 people tell me that they couldn't run a mentorship. Today, I got one of them back. So yesterday was terrible. Today was a lot better. Flexibility and ability to adapt to change. That's just one example, and that was just 2 days. And that was not involving any patient crises. That was just, a little bit of a crisis for me and for students that never even knew about it. Professionalism, it really is important to present professionally, to present that so that our patients and our families know that they can trust us, that they know that they're in the hands of someone who can care for them and that they will be cared for. Regular and open communication with field instructor is crucially important. If you wait too long to ask for help, then you're not going to get the help that you need. And so all of our field instructors are supportive, but you have to ask for help and you have to have that open communication to get that help. Openness to new experiences and being willing to challenge yourself. I can't imagine, the internship experience probably brings new experiences every day, every week. And it's exciting, it's fun, it's one of the best years of my life. I think a willingness to experience that and let yourself experience that and being willing to put yourself out there and challenge yourself a little bit and get a little bit out of your comfort zone in a supported way, okay? Because if you go back to the slides, when you're doing those therapy appointments in outpatient psychiatry, you are observed, you're being held, okay? You're not on your own, and you can be outside of your comfort zone and know that someone's got your back. And if you're in a med surg unit and you're in the middle of a crisis, help is just a phone call or a page away. So you are being put into places where you could be out of your comfort zone, but you are also supported. We're not going to put you in a place where you're going to put a patient at risk. You're not going to be at risk. You're going to be supported, but you're going to be uncomfortable. But you're going to come out of it stronger and more confident and more skilled. Questions?
Yeah, thank you, David and everyone. So, yeah, this is the time for you all to be able to ask questions and, a number, there are a handful of us in the Office of Field Education that have come from Michigan Medicine, myself included, was at Michigan Medicine for quite a long time. And, I was part of the student program, had many students myself. I was a field instructor there for many years. And I think it speaks to the student program there that several of us came over to the School of Social Work because we loved working with students, and the student program was where we started doing that. So I think that speaks to those experiences and what the student program can offer. So many of us would be delighted to be able to speak even in more depth about medical social work, the experiences of healthcare and social work in general. So just know that that's an opportunity as well. So questions that you all have, if there are questions for those attending online, we're happy to take those. And I'm wondering if any of my OFE colleagues would be willing to maybe take the microphone around to those so that the people online could hear. Would love that. Thank you. Yeah, take maybe the mic from, the table there to take around to the tables. They can hear. Great, thanks.
Hi. My question was, I was really interested in all the educational opportunities that you listed regarding like clinical training, seminars, other things like that, workshops. Are those only open to students that obtain a placement in a Michigan Medicine setting, or is that open to all social work students?
Mostly the answer to your question is only Michigan Medicine Place students. There are a few exceptions to that, sort of. Is it Mari, I think?
Yeah.
Yeah. Yeah, Mari Pitcher. Yeah, so placements at Mari Pitcher can access our mentorships. So there are some opportunities. There's also some independent study students that can access our mentorships. But the seminars and the clinical skills training, I'd say 90% of the clinical skills and other workshops are really only accessible just because of the scheduling to the interns in our program.
Hi there. I have a question about, I know Michigan Health has taken over a lot of hospitals throughout the state. Are the placements that we're talking about purely just in Ann Arbor, or like I live in Lansing, so I'm wondering, will there be placement opportunities there at the Sparrow Hospital?
Good question. All the placements that we're talking about today are here in Ann Arbor. All of the takeover of other health systems is still pretty nascent. We're just sort of, our social work departments aren't connected yet at this point.
As far as pathways, my pathway is child welfare and families, and I'm very interested in working with children and families in the hospital. Would I want to keep that pathway as it is or move it to something like IP? Like, is there one that is more preferred to work for Michigan Medicine?
I'm sorry, can you repeat the question?
Yes. For as far as pathways, if you want to work specifically with children and families, I saw on one of the slides that whole unit that works with them. If your pathway is child welfare and families, would you keep it that way or would you move it to something like IP? Is there one that's
Oh.
more preferred for Michigan Medicine?
You mean in terms of your focus here?
Yes, because I
Yeah.
know they mentioned that that's important for field study, that your pathway matches your field study.
I can speak to that
Yeah.
more. So if you're unfortunately, Mott Children's Hospital does not have any placements available for winter this time. But the inpatient child and adolescent and outpatient child and adolescent psychiatry does. So if you would be in one of those areas, so Mott inpatient child adolescent psychiatry does have placements available. So if you are in one of those placements, that still fits within the welfare of children and families pathway. So it could be for either interpersonal practice or child and welfare, the child welfare pathway. Either one would be fine. It would fit for both of those pathways.
Okay, because I just heard people were preferring one over the other, so I wasn't sure if that would just work, because I know my realm was with children.
Yeah, either one would fit for that.
Okay,
Mhm.
perfect, thank you.
Hi, thank you guys so much for doing this. My name's Eleanor. I just had a quick question piggybacking off of the one on the education and the training. So do all of the field placements at Michigan Medicine, including the hybrid and macro, have access to all of like the student training, all of that? It's accessible for everyone who has a field at Michigan Med?
Yes.
Okay, cool.
Hi, I have a question. So I'm interested in multiple placements that you guys have like listed. Like I don't have like a specific one that I'm like, I need that one. Didn't know if that was like a way to be able to say that on the application that I'm interested in multiple, or do I have to commit to one of them when applying?
That'd be you, Amy.
So when you're applying, you do have to list your priorities in terms of what's your first choice, second choice, third choice. So you do, but on your application, there are also places for you to be able to write other notes to us. That's part of your application that doesn't go then to Michigan Medicine. Those are just notes for us in the Office of Field Education. So you can make a notation to us that if to be able to say, I'm just very interested in having a placement at Michigan Medicine. These are my areas of interest. As we're then reviewing your application, if we see kind of what your areas of interest are, we can also maybe look to see where have the numbers been? Are there 10 students that have prioritized this particular placement for one spot, but maybe you've also expressed interest in this other placement, but maybe you listed that as the third choice, and maybe you're the only student that listed that one? Maybe we might say, maybe you want to shift, and maybe that should, maybe you might want to consider that being your first, if you make some kind of notation of that, those are things that we could reach out and have a conversation with you about. So that's certainly something you might want to consider. One thing I just was thinking about as others were presenting is that you do want to make sure that as you're doing your early application, that you are putting your Michigan Medicine choice as number one. So I know I said diversify your choices, but do make sure with your early application that you do have your Michigan Medicine choice as your first choice. So.
Just, I think some folks were able to speak, but I wonder if there's others, so that if students wanted to come talk to you afterwards, if we could just go down the line, if you weren't able to speak, maybe just do a brief introduction where you work, because I think the students that might jog some questions too. Maybe we could go down.
Hi, everyone. My name is Karen. I am a Michigan Medicine social worker, but I work at the School of Dentistry. My field placement has I've only been there 3 years. It's a brand new place for social workers to be. It's growing across the country, but historically my placement has indicated. Thank you. Is this better? And I'll talk real close to it too. Has been more of a macro kind of placement. It just recently, yesterday, got commitment, last night, as a matter of fact, at 7 o'clock, a commitment to a program to introduce social work into a clinic on a regular basis, and I am beyond thrilled. So that is going to be a clear-cut opportunity for folks to learn a lot of the strategies that were talked about already, the assessments and referrals and other kinds of things. However, there's another piece of it as well that would be an opportunity to work on different projects, different program development. It's an opportunity to see how policy at the meso and the macro level influence interpersonal practice. If you're somebody that always asks why, this is a good opportunity to kind of see how some of those things play out and why things are the way they are. And I would like to also add that doing macro work, it was something that's just becoming apparent to me, also kind of parallels the experience of doing micro work. It's a very similar processes. You can see how change and development they're just very similar pathways. And then on just a little more of a personal note, I would encourage folks to really have a clear-cut idea on the skills that they're hoping to learn. Most of the skills are transferable to any population that you work with. So it's great to have your first, second, and third priorities. However, also know that you can develop those skills to be a successful practitioner in so many placements. So keep an open mind with that as well. And then I'll be open to questions if anybody has any.
Yeah, and Karen's placement with dentistry, that's one of those placements I was referring to where a student was like, never in a million years did I ever think I wanted to work in dentistry, but boy, was that an opportunity. I got to do so many things that have been so cool that I never would have imagined. So it really is true. Yeah, thanks. And Latricia too.
You can hear me? Hello. Hi, you all, it's a lot of information that you're getting. And you're having to make some really critical decisions. I'm Latricia Wiley. I'm the Children and Women's Bereavement Program Manager with the Office of Decedent Affairs. And while I don't have a placement that's open right now, we do have one through on the adult side of our program, which really looks to oversee all of the aspects of care once the patient has died. There are many things that you don't necessarily think about that go into caring for a decedent. And so just in terms of being able to do a lot of program planning, program development, providing bereavement support to families following a death, that this particular program also on the adult side has connection with the medical examiner's office. And so in cases where there's been a suspicious death, a traumatic death, there are opportunities to have exposure to those types of cases as well. You have the opportunity to work with the autopsy and forensic team within the health system. So there are a lot of different opportunities in terms of education and exposure, doing training, there's a speaking engagement that prior interns have done, being one of the panelists or presenters for the All Women Are Leaders. So there are also those opportunities for advancement and really being able to just really stretch yourself. Again, there's so much that you don't necessarily think about as it relates to end of life that can be really, really informative if you choose to consider this placement. It is hybrid. You really do have an opportunity for both macro and micro in this placement. So I just want to encourage you all to consider Michigan Medicine overall. I too am a graduate of the MSW program here back in '97, long time ago. However, I had no idea coming in about medical social work. And so I was only thinking about community organizing and those types of programs. But it wasn't until and the placement that I had was phenomenal. It really did change the trajectory of my career. So the placements that you do choose do really have a huge impact on your career path. So I encourage you to think about it in that aspect as well. However, so I went down that path, worked at the Sexual Assault Prevention Awareness Center for a number of years, and then transitioned over to the hospital side. And when I look back and I think about what you all as interns in the social work program at the hospital have exposure to, it really is phenomenal. You have exposure to all these different clinicians, being able to shadow so many different opportunities that you may not necessarily have in other placements. So strongly, strongly, strongly encourage Michigan Medicine as something to consider.
Hello, I'm Lauren. I was a social work intern in child and adolescent psychiatry 2 years ago. So ended last December when I graduated, and then hired on as a fellow. So I'm a first-year fellow with child and adolescent psychiatry as well. And absolutely loved my internship. So I can answer kind of questions more specifically about my experience for sure. But there's such a variety, I think, of opportunities that makes Michigan Medicine really unique. And you can really make it what kind of you're looking for and what your interests are, which I think is really cool. And additionally, in child and adolescent psychiatry and adult psychiatry, it's very hands-on, as Martin mentioned, where you get a lot of very supportive feedback from your individual supervisor, as well as in mentorships, preceptorships, which are incredible. There's so many awesome opportunities, which I think I really enjoyed, and I think really set me up for success post-graduation, kind of preparing me for what psychotherapy looks like and feeling confident kind of entering the workforce.
I'm Martin Hegestad, working in adult outpatient psychiatry. I've actually have been there for almost 20 years now because I did my internship in the outpatient clinic back in 2005. And so I've never really thought of myself as someone who would work at a hospital, but here I am almost 20 years later. Want to also just put in a little plug for our addiction treatment services program. Some people might, have be saying to themselves, I never really thought of myself as interested in addiction treatment. I'm really interested in psychotherapy more generally. Our addiction patients almost always have some type of additional diagnosis, general psychiatric diagnosis. And that is also a program that offers really excellent psychotherapy training in a tight-knit clinic that is really also an exciting place to be. Also, I'll just mention that we do have postgraduate fellowships for MSW graduates. Anyone can apply who has a recent MSW, but certainly being an intern in our clinic is a good way to get a sense as to whether you might want to continue. It's a really superb opportunity to stay around for an additional 2 years and to get to the point where you would be ready to be fully licensed while getting a lot of really continued excellent psychotherapy training and supervision.
Okay, well, I know we are just past 5:30, so I think several of us are able to stay and answer if you have individual questions, to be able to help answer any of those individual questions. So you're welcome to stay and ask those. But I want to thank all of you for attending online and in person. And especially I want to thank, again, all of you from Michigan Medicine for coming here to be able to share your information, share your time with us, and also sharing these opportunities. It really is a phenomenal experience for students, and I'm really grateful for your partnership in being able to provide these experiences for people. So thank you so much. And look forward to getting to connect all of you to these opportunities. So thank you. Those online, if you have questions, we still have people answering in the chat as well. So have a good night.